Yes, I'm Benjamin Levy. I'm a lung cancer doctor. I'm an associate professor at Johns Hopkins School of Medicine. So we're still, even in 2021, learning about the potential neurocognitive effects of chemotherapy for patients with lung cancer. This is probably one of the more underrepresented aspects that has not really been studied all that well. And I will say that for patients that are on systemic chemotherapy for lung cancer, that it is absolutely possible to continue to work. In fact, I encourage it. If patients want to work and they feel like they can, it is something that we really encourage because we want patients to live their life. The question always comes up about chemo brain. You know, this is, again, we're really still learning about what this means. It's been looked at a lot in breast cancer, but you know, this is the specific complaints that patients will say while on systemic chemotherapy is, you know, I'm having memory issues. I'm not able to do multiple things at a time. My mind feels like jello. I just can't engage. I'm in mid-sentence sometimes with a family member or friend, and I forget, you know, what I was talking about. And it's clearly there's something biologically going on because we have very sharp cookies who come in and then, you know, who get chemo, and then it's really tough for them in some ways, and it can interfere with their ability to work. You know, why is this happening? And do we have a biological explanation? Well, we do think that chemotherapy may alter the neuronal integrity. It may impact on structural networks of the brain, and we just don't know how. And there has been some studies looking at this, looking at repeat brain MRIs in patients, and that suggest there may be some disruption of this integrity, neuronal integrity, that's leading to a lot of the symptoms that patients are having. Again, most of this data has been looked at in I would say in breast cancer. There's been a lot of data on this, suggesting that this phenomenon is real. I think the question comes up: well, what are the interventions, and how do we get around it? And this is where we're still, I think, a little bit in the dark in trying to understand. I mean, I think there are relaxation techniques that we recommend. We work with our integrative oncology team. So we have an integrative team that can do acupuncture and aromatherapy. Again, we're thinking outside the box here. Physical exercise can help for those patients who are receiving chemotherapy. We can refer patients to neuropsychiatrists for specific training programs that can help exercise the brain. So there are all kinds of strategies that we can look at. But this is something that I always really work hard with my patients on because we can get them through that. I will tell you that we, you know, in terms of pharmacological interventions, in terms of medications, we just don't have a lot of data on what to do. Ritalin or modafinil, others that may be looked at. I try to avoid those and go more with the supportive care routes, but this is real. This should be looked at. I wouldn't also hesitate to tell your provider about it or your oncologist, because there are interventions that could autocorrect this over time.